Hello and welcome back to the vlog. My name's Ed Hope, a junior doctor in the UK, and it's been a couple of weeks since I've given you an update on my experiences of being an emergency doctor in this pandemic, and that's because we've had a really tough couple weeks, and I'll come on to that towards the second half of the video. But what I want to talk about first of all is what's been happening on the ground. So in my last 9 shifts, 8 of them have been in the green zone, so seeing patients that don't have suspected COVID-19, and that's fairly representative of what we're seeing in general in the emergency department, so fewer cases of COVID-19. And although that's what we're seeing in the emergency department, let's not forget that that doesn't mean it's disappearing from our hospitals in general, because there is a bit of a lag. The average stay of someone with COVID-19 that needs to come into hospital is over a week. So we're going to still see those medical wards, and also still particularly see an ICU. So patients will stay much, much longer if they need ICU admission. So although we're having a bit of a break in terms of numbers in the emergency department, I'm still thinking of my colleagues who are, on the wards, and particularly on ICU, that are working in really difficult conditions there. And the sad truth that many of these patients will not make it. We're still seeing in the UK around about 1,000 deaths a day. But that number is thankfully falling. And so these fewer numbers we're seeing in the front door of the emergency department is down to the benefits of the national lockdown. I'll stop short of celebrating lockdown too much, because we know, as we've described in this channel before, that lockdown is the least worst solution and comes with it many other difficulties, and we are seeing those kind of difficulties present to the emergency department. So many of the patients I've been seeing over the last few weeks are at a mental health crisis, suicidal, drug overdoses, manic episodes, psychotic. These are things that we are used to seeing in the emergency department, but often made worse in lockdown, and we are seeing the tip of the iceberg. So for every patient we see in the emergency department, there's going to be many more that are struggling at home or in other circumstances. So really the summary of the first half of this video is we're seeing fewer numbers on the front door, at least where I am in Essex, and I've said this all along, that I just give my view on where I am. Each individual health professional, even in the same hospital as me, is going to have a different view. So if you spoke to a doctor in ICU, they'd still say things are, really at capacity, but hopefully those things will change as we're seeing fewer patients in through the front door. The second thing I want to talk about, and what's made it hard to do a video in the last couple of weeks, is because there's been one kind of overwhelming problem, thing in our thoughts where I've been working over the last couple of weeks, and that's something that many healthcare workers will be experiencing or have experienced during this pandemic, and that is the loss of a colleague. I think up till December, just a couple months ago, there were over 850 healthcare workers had died during the pandemic. In the US, I think it's over 3,000, and that was back in December, so clearly the numbers are going to be more. So many people will be experiencing what we've experienced in our department over the last couple of weeks. It's impossible to explain that emptiness you get when you lose a colleague. It feels very much like you're going to wake up and everything's going to be back to normal, and you feel like being in a job where you see people die would make it easier, but it doesn't. At work we are a family, and we don't always get along with each other, but we need each other, we rely on each other, and we lean on each other. And that's from everyone. So the nurse you see that looks after you, to the domestic staff that keep everything clean, that keeps us safe and looks after us. But as a family though, we have to come back together, and my hospital and the people, I say my hospital, but my hospital is made up of people, and the people have just been amazing. The response, people have just come together in a time where things were already tough. The senior leaders have been doing daily, what's the word for it? I was going to say meetings, but it's not a meeting. It's just bringing people together to talk and open up and share stories, and they're extremely highly charged. Emotionally, it's not for everyone. People grieve in different ways, but it helped me just to come and have that quiet few moments to come together and talk in a quiet scenario away from the busy emergency department, and we'd share stories of the person we lost. We would give our thanks to the work they did and really just pray for them and their family and close friends, because they're the people that need that right now. So after coming out of these incredibly moving and emotional, intense moments, the response is, what you expect from a team of determined, dedicated, professional people. 10 minutes later, the same people I was surrounded by, we were seeing another patient who'd come in who needed medical attention, and the response was as good as ever. I don't feel comfortable mentioning the names of the people that have died at my hospital. I don't have the family's permission. I don't know they'd want that type of thing talked about, like this. So it's really just to communicate these are the kind of things that are happening and the thoughts that many healthcare professionals would be going through. I think our experience of this pandemic is going to be defined by our own personal loss. I think lots of people will be very lucky and wouldn't have lost anyone close to them, and for many people it will just be known as that time where their whole world changed or their whole world disappeared. So despite going everything through this incredibly challenging time and feeling like we're on the way out with the vaccine and the cases decreasing, we then have something like this, which is it really rips your guts out, and will be a defining moment for everyone at my hospital. So there you have it. Not a lot really to say about it. We'll continue to press on, get through this, rely on the people around us and keep going. There's only one way out of this. Again, thank you for all the continued support on this channel, and I hope you're all well, and I'll be back soon.